Guys, welcome back to Medical Coding with Blue. Today's episode is all about the RHIT and the RHIA exams. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, let's start out with this. The RHIT is a Registered Health Information Technician. This is the associate's degree, right? The associate's degree designation. If you go through an approved CAHIM program, I will leave the link for CAHIM in the description box. Guys, please don't ask me for it. I'm going to point you back to the description box. If you go through an approved program through CAHIM for your associate's degree, then you can sit for this designation afterwards. Not all programs are approved through them. So you have to make sure if you want to sit for this RHIT designation that you go through an approved program. Then there's the RHIA, and that is a bachelor's degree, the health information management degree, right? And the RHIA, Registered Health Information Administrator, it has to be approved through CAHIM, the program that you go through, in order to be able to sit for this designation as well. Now, when it comes to sitting for these exams, last week I was asked, because I think I was talking about the CCS exam, and I was asked, why don't the RHIT and the RHIA require medical coding books? Because these degree designations are not, their program is not concentrated on medical coding. This is why there are certifications. The CCS, the CCA, CCSP, or the CPC, right? If you're going to go AAPC. But the RHIA and the RHIT are both offered through AHIMA. They are the only ones in the industry like this. AAPC does not have an equivalent, okay? Because these are the degree designations, and AHIMA controls both of these, the RHIT and the RHIA. Now, in order to, again, go through this, you have to go through an approved program, of course, complete your program, and then when you graduate, then you can sit for the degree designation, or you can do an early take. You have to apply for it and things like that. If you're within a certain amount of time, you can do the early test taker. But you can go to the website, which I will leave that link in the description box below, so that way you can check it out. But I wanted to talk about the exams and the fact that they don't require these medical coding books, the ICD-10-CM, the CPT, the HCPCS, the ICD-10-PCS. They do not require these books at all. There are no books required at all. You are just going to the test center, just you yourself, all right? Now, these exams are administered through Pearson VUE, which is a third-party testing center that AHIMA uses. And you have to, when you're applying to take this test, of course, you're going to apply with AHIMA. Then they're going to give you the link for the Pearson VUE, and then you set up an account with them, and then you look at their schedule, and you pick a location and a time, and then, of course, you show up there for your exam. Now, I will say this, because a lot of people still don't know this. You cannot flag these questions and return to them. You have to answer them as they come up, because it will not let you advance if you do not answer the questions, okay? So when you go to the Pearson VUE Center and you do not have any jewelry, they do say that you can wear a wedding band, but you cannot have a necklace, you can't have earrings, you can't have a watch, you can't have a belt, you can't have anything. You have to be prepared to be searched. They will search you. Sometimes they'll make sure that you turn your pockets inside out and that kind of thing. They will look at your glasses. They will, if you have a big barrette in your hair, you have to take that out. And so you can't have anything, nothing. And so you just got to make sure that you are in something comfortable that you can be in for a few hours, okay? Because these exams, the RHIT is a 3.5-hour exam. The RHIA is a 4-hour exam. And I'm going to go into how many questions and things like that. But again, you should know that you have to, as you're taking the test, you cannot flag and come back to it. They used to be able to do that, but now they don't do that anymore. So I don't know why they changed it, but whatever. So I'm going to read this. If you are in the associate's degree program and you're going to sit for the RHIT, you should know that right now the beta period for the RHIT exam will start on October 1st, 2022. So they are in a beta period right now. Now, a beta period just means that they have to wait until a certain number of people have taken the exam before they release the scores. So if you take your exam, you're not going to know for, I think, up to 6 oh no, up to 10 weeks. You won't know if you passed or not. So if you have your choice, you know, whether to wait a little while before, like, enough people take the exam before you schedule your exam, giving yourself a little bit more time to study, that might be helpful. Or you're going to have to wait for those 10 weeks. So here it says the beta period for the RHIT exam will start October 1st. Beta exam results will only be provided following the exam review and determination of the passing standard. The time between the end of the examination administration period and the release of the scores to candidates will be up to 10 weeks. Please do not contact AHIMA or Pearson VUE at this time. All beta candidates will receive an email notification when their results are read. So then it describes what the RHIT is. And I'm reading this directly from the AHIMA website. Again, I will leave this in the description box below. While most RHITs work in hospitals, they are also found in other healthcare settings, including office-based physician practices, nursing homes, home health agencies, mental health facilities, and public health agencies. RHITs may also be employed in any organization that uses patient data or health information, such as pharmaceutical companies, law and insurance firms, and health product vendors. RHITs ensure the quality of medical and health records by verifying their completeness, accuracy, and proper entry into computer systems, use computer applications to assemble and analyze patient data for the purpose of improving patient care or controlling costs, often specialize in coding diagnoses, procedures, and patient records for reimbursement and research. Additional role for RHITs is a cancer registrar, compiling and maintaining data on cancer patients. And then it talks about the eligibility requirements. Candidates must meet one of the following eligibility requirements to sit for the RHIT examination: successfully complete the academic requirements at an associate degree level of health information management program accredited by the Commission on Accreditation for Health Informatics and Information Management Education, CAHIM, like I said, or graduate from an HIM program approved by a foreign association with which AHIMA has a reciprocity agreement. Then it talks about applying for the exam. Non-member price is $299. Member price is $229. And then they talk about eligibility for early testing. The pass-fail rates for the RHAT exam in 2019 were 76%, 2020 was 78%, and 2021 was 69%. So this is a tough exam to pass. Very tough. And these are first-time test taker rates. So the RHAT is a timed exam. Exam candidates have 3.5 hours to complete the exam. The total number of questions on the exam range from 130 to 160 total items. 130 and 160 total items. The exam is given in computer-based format, so we don't know how many to expect. So that's why they're telling you the exam range can be between 130 and 160 total items. All right. AHIMA exams contain a variety of questions or item types that require you to use your knowledge, skills, and experience to select the best answer. Each exam includes scored questions and pretest questions randomly distributed throughout the exam. Pretest questions are not counted on the final results. The passing score for the RHIT is a 300. Competencies for the RHITs fall into 6 domains. Each domain accounts for a specific percentage of the total questions on the certification exam. And then it says to see the outline below. So what do we have here? Okay, so they have both content. All right, so here we go. The first domain is data, content structure, and informatics governance, 19 to 25%. Domain 2 is access, disclosure, privacy, and security, which is 14 to 18% of the exam. Domain 3 is data analytics and use, that is 12 to 18%. And then domain 4 is revenue cycle management, which is 19 to 25%. Domain 5 is compliance, 13 to 17%. And domain 6 is leadership, which is 9 to 12% of the exam. So you guys can check out like the specifics on the breakdown. I'm in a bit of a time crunch, that's why I'm not going to go through each and every single one. But just know that those are your domains for study, all right? Now for the RHIA side of the house, the Registered Health Information Administrator, it says RHIAs are the critical link between care providers, payers, and patients. The RHIA has a comprehensive knowledge of medical, administrative, ethical, and legal requirements and standards related to healthcare delivery and privacy to protect patient information. They are not in a beta period right now, just so you guys know. And we're in October 2022, and they are not in a beta period, according to the website. There's nothing mentioning that. RHIAs work in multiple settings in the healthcare industry, including hospitals, multi-specialty clinics, and physician practices, long-term care, mental health, and ambulatory care settings. They also work in non-patient care settings, such as managed care and insurance companies, software vendors, consulting services, government agencies, education, and pharmaceutical companies. RHIAs manage people and operational units, participate in administrative committees, and prepare budgets. So you got to be good with math, folks. You got to be good with math for this one. The RHIT is the same way too. You got to be good with math as well, because usually they're working with data. Interact with all levels of an organization, clinical, financial, administrative, and information systems that employ patient data in decision making and everyday operations. Manage patient health information and medical records, administer computer information systems, collect and analyze patient data, and use classification systems and medical terminologies. And then it talks about the eligibility requirements. Successfully complete a baccalaureate level academic requirements of a health information management program accredited by CAHIM. Successfully complete the master's level successfully complete the master's level academic requirements of an HIM program accredited by CAHIM, or successfully complete the academic requirements of an HIM certificate of degree post-baccalaureate program approved by CAHIM, or graduate from an HIM program by a foreign association with which AHIMA has a reciprocity agreement. If I said that wrong or butchered the word, you guys know what I'm trying to say. It's on the website. All right. So applying for the exam, the non-member price is $299. The member price is $229. And then talks about eligibility for early testing. And then about the RHIA exam. In 2019, the pass rate for first-time test takers was 70%. 2020, it went up to 74%. But in 2021, it was 58%. So this, again, is another one that's going to pack a punch. These exams are nothing to play with, guys. These require you to know a lot. So the RHIA is a timed exam. Candidates have 4 hours to complete the exam. The total number of questions on the exam range between 170 and 200 total items. The exam is given in a computer-based format. AHIMA exams contain a variety of questions or items that require you to use your knowledge, skills, or experience to select the best answer. Each exam includes scored questions and pre-test questions randomly distributed throughout the exam. Pre-test questions are not counted in the final results. The passing score for the RHIA is a 300. Competencies for the RHIAs fall into 5 domains, a difference from the RHIT, which had 6. They only have 5. Each domain accounts for a specific percentage of the total questions on the certification exam. See the content outline below. 19% is information governance, that's in domain 1. Domain 2 is compliance with uses and disclosures of PHI, 26%. Okay, it's heavy. This is a heavy topic on that one. Domain 3 is data analytics and informatics, 24%, another heavy hitter. Number 4 is revenue management, 16%. And domain 5 is management and leadership, which is at 15%. So again, knowing what these degree designations are for, these are for our leadership. And it shows directly in the outline of the exams how important, coding is to those exams. It's a very small portion of it. And again, if you look at the degree programs and if you look at all of their syllabus for all the subjects that they cover, I mean, medical coding is just a small blip. And so if you think that you need a degree to be a medical coder, you are surely wrong. And if a recruiter is telling you this, again, folks, you need to look at who you're getting advice from. If it is a recruiter, they're trying to sell a program. If they actually told people all the things that go into these degrees and what you can actually do with them. And if they say, well, you can be a coder with a degree, with the RHIA or the RHIT, certainly. You certainly can. And I know a lot of people that actually do. But if you look at it and you are a medical coder who just is doing medical coding with an RHIT or an RHIA, you are technically working below the ability of your degree designation. And it's an expensive way to go. It's a very expensive way to go if you just want to be a medical coder. If you just want to be a medical coder, by all means, go for the medical coding certifications, because the medical coding certifications, it's the end of the day, guys. And I'm trying to film this, and so I'm not going to film this again. So what you see is what you get, all right? Because this is about like the 7th take I've been on, so it's late and I'm tired, so you can kind of tell you guys got to work with me here. The CCS, the CCA, the CCSP, or even the CPC, these all hold a lot of weight in the industry. And of course, the degree designations, RHIT and RHIA, they hold a lot of weight as well. But the degree the certifications, they hold a lot of weight, and they have been matched up to the degrees before, where people will go in and they'll be applying, and of course, if somebody has a degree, they're like, oh, okay, well, they've been through a degree program. But when it comes to testing on proficiency in medical coding, somebody who has a medical coding certification sometimes can know a little bit more than a degree holder, because again, that's not the concentration of their program. If you're asking somebody that's coming from the degree program about privacy and handling data and things like that, they're all over that because that's a concentration in their program. Where in medical coding, yes, it is part of it, but it's not all of it. Not like how we have to know the classification systems, and we have to know how to look codes up and how to apply codes and modifiers and things like that, and which code goes where, and the different reimbursement methodologies. Coders have to know all of that, whereas degree holders, yes, they do have to know some of it, but it's not the concentration. This is why I always say, if you want to be in leadership, then of course the degrees are the way to go. But if you don't know, by all means, save yourself time and money, because these degrees take time to get. You can't just fly through willy-nilly and say, oh yeah, I want to be done with the program, whatever. No. Degrees take time to get, where certifications, yeah, you can pick up a little speed, but you got to make sure that you're prepared for those exams, because you're going to be tested when you get onto the outside. Now, some facilities that don't know, and you would be surprised, there are a lot of places that do hire for medical coders that have no idea, not a clue about our education and what these degree designations mean. Sometimes they say, yeah, we want an RHIA and an RHIT, and they want to pay you what just somebody off the street who's a coder would get. Now, if you think that a degree is going to make you more money, then you're sadly wrong, because Even when I had my CCA, which was just last year, I still made more than an RHIT and an RHIA. Still. And that was just with the CCA. And not by a little, by a lot, guys. So that's something that you really got to think about. You know, these recruiters, again, they're going to say things that's going to be beneficial to their school. It's going to be beneficial to their program. They don't care. Some of them do. But not enough to tell you guys this is the truth. This is a real deal. If you want to go after these degree designations, know that this is going to put you in the driver's seat to be in leadership. And if that's not what you want, then you want to go with the certifications. And if you want to try the certifications first and then come back to the degrees later on, at least you'll have an idea. You will know. Or you'll say to yourself, no, I don't want to be in leadership. I am quite happy doing what I'm doing. And that is totally fine. But know before you start investing years, or heaven forbid that you sign on the dotted line for a student loan for something that you don't even know what you're getting into. All right? And that's the thing that, you know, I always hope that this catches somebody before they sign on that dotted line. Because, you know, guys, student loans are very bad because they last forever. Everybody knows this. I have always been one that I have always been resistant, and I will not get a student loan if I can absolutely help it. I will do everything I can to pay out of pocket before I ever look at a student loan, because it's just not worth it for everything that you have to go through. All right. And if it really does mean a lot to you, you'll find a way. You'll find financing. You'll find, you know, a way to be smart about it. But don't be so cavalier thinking that you have to have a degree in order to do well. I've done very well, even with my CCA, for many, many years when I had it. And now, of course, I have the CCSP and the CCS, and I did it this way because I got the CCSP first. I had to put my CCA to bed. The CCSP, of course, of the CCS and CCSP was the easier for me to get at the time because I have been in the outpatient setting for 13 years. So CCSP first, and then I said I want to go for the mastery medical coding certification, which is the CCS. That is the gold standard of medical coding credentials, because it is the one medical coding credential that says that you can do both and that you've mastered both inpatient and outpatient coding. I'm just saying. So when you have those, you know, and that's what you want to do, that's great. But you want to move up, and sometimes, before I wrap this up, sometimes your employer will actually pay for you to get a degree. Now, isn't that better? Isn't it better that your employer is going to invest in you to get that degree? Doesn't that make more sense? Rather than you having to go through all these things, getting a student loan and going through all this headache when your employer will be happy to pay for it. Some employers do, some don't, but a lot of them do. So that is something that you may want to consider if you want to get in and then, you know, go into the degree programs. Just my advice anyway, guys. All right, I'm gonna wrap this one up. Thank you guys so much for joining me and putting up with my fumbles in this video, but what are you gonna do? I will see you all in the next episode. Like, subscribe, and share. Bye.